My name is Prash Patel. I'm a consultant urological surgeon in North London. I was inspired to do the EMBA Health because I was looking at my own personal trajectory. I'm one of the senior surgeons doing very complex operations and have been doing that for several decades now. And the amount of tech which has come into my field, particularly with robotics and things, I do feel that in the next few decades there will be a new concept of surgical obsolescence. Not that the surgeons will completely disappear from the planet, but the kind of work they will be doing will be very different from what we are doing in present times. And I want to be really ahead as an innovator as well as an adapter of the newer technologies, particularly with artificial intelligence coming into the whole field of healthcare in general. So I want to prepare myself for that part, be a leader, and then happily retire. What I have gained from the EMBA program so far is the founding principles of management. And this is not just related to business management, but its application within healthcare. I've learned the principles, I've learned the concepts, I've learned the theories of what it takes to organize, to strategize, to plan, to execute, to look into what the financial implications and the economic aspects of healthcare delivery is. So those are the core principles which I think I'm learning at the moment, and it'll be a continual process, I'm sure. Why do I now think of doing an Executive Health MBA? And that is because what I learned from my deficiencies as a leader. And what the MBA is actually providing me is it's cutting off all those rough edges which I had as a leader. I'm trying to value what organizational behavior is, how to deal with different aspects of just the process of how healthcare is delivered, particularly in the UK, but even individuals, the teams, all the qualities which come with that. And that I feel is actually going to top up my leadership skills for the future. I have thoroughly enjoyed one of the aspects of the program which I'd like to let you know, and that was around the simulation exercise. We had in our second modules a financial simulation where the whole group of the MBA students were divided into 5 different factions, and this was a online simulation of running a hospital with a fixed budget and all these different scenarios coming in. There was a pandemic, there was hospital strikes, there were staffing issues, there were costing issues, and how do we manage the hospital. So we learned a lot of skills through that, what a chief executive officer has to do versus a CFO and this chief strategic officer, and those little role play which we did, and then applying that to compete against the other hospitals so that we can get ranked the most was the most terrific exercise, which really encompasses the whole MBA program within that simulation. The health sector, particularly in the post-COVID times, is really changing. We've experienced shifts in the way we actually run our day-to-day business, let alone restructuring the services within the hospital, within the network, within the city. And with further political changes which are really imminent, I'm likely to see more and more of these things happening. Not just that's about how do you deliver the NHS, but what I have seen is, through my experience, a lot of inefficiencies which come up with productivity of individuals, and all those things are now kind of standing out because of a massive workforce crisis. And finally, the biggest change which is happening, at least in the last few years and in the next decades, will be the involvement of artificial intelligence in the healthcare sector. So these are the most dynamic changes which I think we will experience, not just within the UK NHS, but probably globally. What I found when I was looking for a health-related MBA through my research, I found the UCL Exec MBA most appealing to suit my needs. And the reason I say that is because I'm an extremely busy clinician in the NHS as well as a bit in the private sector. I have other commitments with the academics, and in a very busy schedule, how would I actually go on to hone in the skills for an MBA, let alone the learning time, the reading time. And the most attractive aspect of the UCL Exec Health MBA is its flexibility. The lectures, the online lectures and everything are picked on the days and the times as well when I can actually come out of my regular work, listen to those, and then carry on with my rest of the day's work. And if I was to miss it, say for example if I'm operating, there was always a chance of catching it up on the tube when I'm heading back home, because everything is recorded online. I like the way the whole breakaway sessions are made, and I particularly like the week when we all MBA students get together at the university, see face to face, and engage with each other in a group-based learning format. The flexibility which the program provides does help me some of the principles to really implement on a straightaway basis. For example, recently I was involved with doing a business case for one of the things we had to do a capital investment in, and it took me no time. I learned about net profit values, and I could just plumb in those numbers, and my business and finance manager of the organization found that really helpful. Because I applied what I had just learned a few weeks ago in my real life. So it actually does. I would highly recommend the Executive Health MBA for health professionals, particularly those like myself, who are itching to do something, learn a new skill, take up senior positions within an organization, write business plans, or think of innovation, having their own startups and so on and so forth. So in those kind of individuals, I would most certainly recommend that they join the program. They learn the art and craft of the skills which is required to go and conduct these kind of roles, whatever they choose within the health and social care.